The Maya civilization of Central America is claimed to have been the first to use cocoa. In the 16th century, Spanish invaders brought it to Europe and it immediately became famous as a health-promoting medicine. Crushing cocoa beans and extracting the fat or cocoa butter results in cocoa powder. Cocoa is well known nowadays for its use in chocolate making. Modern study, on the other hand, has found that it does contain vital components that can help your health. Here are some of cocoa's health advantages. 1. High in polyphenols, which provide a variety of health benefits. Polyphenols are antioxidants that occur naturally in foods such as fruits, vegetables, tea, chocolate, and wine. They've been linked to a variety of health advantages, including less inflammation, enhanced blood flow, lower blood pressure, and better cholesterol and blood sugar levels. One of the richest sources of polyphenols is cocoa. It's high in flavanols, which are powerful antioxidants and anti-inflammatory agents. Processing and cooking cocoa, on the other hand, might cause it to lose its healthful characteristics. It's also frequently treated with alkaline to lessen bitterness, which reduces flavanol concentration by 60%. While cocoa is a good source of polyphenols, not all cocoa-based products offer the same advantages. 2. Improved nitric oxide levels may help lower blood pressure. Cocoa, in both powdered and dark chocolate form, has been shown to help decrease blood pressure. This effect was initially observed among Central American cocoa drinking islanders, who had much lower blood pressure than their non-cocoa drinking mainland cousins. Cocoa flavanols are known to increase nitric oxide levels in the blood, which can improve blood vessel function and lower blood pressure. One study looked at 35 studies in which patients were given 0.05 to 3.7 ounces, 1.4 to 105 grams, of cocoa goods, or 30 to 1,218 milligrams of flavanols. It was discovered that cocoa reduced blood pressure by 2 millimeters of mercury, which was tiny yet substantial. Furthermore, the impact was stronger in persons who already had high blood pressure than in people who did not, and in older adults versus younger ones. It's crucial to remember, though, that processing decreases the quantity of flavanols, so the effects are unlikely to be observed in the ordinary chocolate bar. 3. May reduce your chances of having a heart attack or stroke. Cocoa appears to have additional qualities that may lessen your risk of heart attack and stroke, in addition to decreasing blood pressure. Nitric oxide, which relaxes and dilates your arteries and blood vessels and promotes blood flow, is increased by flavanol-rich cocoa. Furthermore, cocoa has been shown to lower bad LDL cholesterol, thin the blood in a similar way as aspirin, enhance blood sugar levels, and reduce inflammation. Heart attack, heart failure, and stroke have all been related to these qualities. An assessment of 9 research including 157,809 participants revealed that eating more chocolate was linked to a decreased risk of heart disease, stroke, and mortality. 2 Swedish studies established a relationship between chocolate consumption and a decreased risk of heart failure at dosages of up to 1 serving of 0.7 to 1.1 ounces, 19 to 30 grams, of chocolate per day, but not at greater levels. These findings show that eating little amounts of cocoa-rich chocolate on a regular basis may help protect your heart. 4. Polyphenols help your brain's blood flow and function. Polyphenols, such as those present in cocoa, have been shown in several studies to improve brain function and blood flow, potentially lowering your risk of neurodegenerative disorders. Flavanols can pass the blood-brain barrier and play a role in the metabolic processes that create neurons and other brain-related chemicals. Flavanols also affect the creation of nitric oxide, which relaxes the muscles in your blood vessels, boosting blood flow and blood supply to your brain. Blood flow to the brain rose by 8% after 1 week and 10% after 2 weeks in a 2-week trial of 34 older persons fed high flavanol cocoa. Further research suggests that consuming cocoa flavanols on a regular basis can improve mental function in adults with and without mental disorders. These studies suggest that cocoa has a beneficial influence on brain health and may have beneficial effects on neurodegenerative illnesses such as Alzheimer's and Parkinson's. More research, however, is required. 5. May help to improve mood and depression symptoms in a variety of ways. Cocoa's influence on the brain may also enhance mood and symptoms of depression, in addition to its favorable effects on age-related mental deterioration. Cocoa's flavanols, the conversion of tryptophan to the natural mood stabilizer serotonin, its caffeine concentration, or just the sensory pleasure of eating chocolate may all contribute to its good benefits on mood. Chocolate consumption and stress levels in pregnant women were linked in one study, with more frequent consumption of chocolate being linked to less stress and improved mood in newborns. In addition, consuming high polyphenol chocolate increased tranquility and happiness, according to another study. In addition, consuming chocolate was associated to enhance general health and psychological well-being in a study of older males. While the findings of these first trials are encouraging, additional study into the effects of cocoa on mood and depression is required before more certain conclusions can be formed. 6. Flavanols may help with type 2 diabetes symptoms. Though excessive chocolate eating is not beneficial for blood sugar management, cocoa does offer some anti-diabetic properties. Cocoa flavanols have been shown in test tubes to decrease carbohydrate digestion and absorption in the stomach, boost insulin production, reduce inflammation, and accelerate sugar uptake from the circulation into the muscle. A higher consumption of flavanols, such as those found in cocoa, has been linked to a decreased risk of type 2 diabetes in several studies. In addition, a review of human research found that flavanol-rich dark chocolate or cocoa can enhance insulin sensitivity, blood sugar management, and inflammation in diabetics and non-diabetics. Despite these encouraging findings, the data is inconsistent, with some studies revealing either a little impact, somewhat poorer diabetes management, or no effect at all. Nonetheless, these findings, along with the more definite good benefits on heart health, suggest that cocoa polyphenols may help prevent and treat diabetes, though further study is needed. 7. May help weight loss in a variety of surprising ways. Surprisingly, cocoa consumption, even in the form of chocolate, may help you lose weight. Cocoa is suggested to aid by regulating energy consumption, lowering appetite and inflammation, and enhancing fat oxidation and fullness sensations. Despite eating more calories and fat, persons who ate chocolate more regularly had a lower BMI than those who ate it less frequently, according to a demographic research. Furthermore, a weight loss trial employing low-carbohydrate diets discovered that a group given 42 grams, approximately 1.5 ounces, of 81% cocoa chocolate per day lost weight quicker than the control group. Other research, on the other hand, have discovered that eating chocolate makes you gain weight. However, many of them did not distinguish between the types of chocolate they ate, despite the fact that white and milk chocolate do not have the same health advantages as dark chocolate. Overall, it appears that cocoa and cocoa-rich products can help people lose weight or maintain their weight, although further research is needed. 8. It's possible that it has anti-cancer properties. Flavanols found in fruits, vegetables, and other foods have piqued attention due to their cancer-fighting potential, low toxicity, and lack of negative side effects. Cocoa contains the highest concentration of flavanols per weight of any food, and can help you get more of them in your diet. Cocoa components have been shown in test tubes to have antioxidant properties, protect cells from reactive chemicals, combat inflammation, restrict cell development, trigger cancer cell death, and assist prevent cancer cell spread. Breast, pancreatic, prostate, liver, and colon cancers, as well as leukemia, have all been reduced in animal trials utilizing a cocoa-rich diet or cocoa extracts. Flavanol-rich diets have been linked to a lower risk of cancer in humans, according to research. However, the data for cocoa is mixed, with some studies indicating no benefit and others indicating an increased risk. Small human research on cocoa and cancer reveal that it is a potent antioxidant that may help to prevent cancer. More research is, however, required. If you enjoy this video, subscribe for more. Thank you.